Welcome, everybody, to the Kitten Veterinary Podcast. I am your host, Dr. Andy Roark. Guys, I got a great one. I am here with Dr. Camille Torres. She is a boarded nutritionist at Colorado State University, and we are talking about puppy and kitten GI issues. So upset stomach, soft stools, diarrhea, things like that. I kind of give her a case with a kitten, but we kind of switch back and forth interchangeably between kittens and puppies. And so she does a really good job of sort of hitting both of those. We're talking about young dogs and cats. The example is around 9 weeks old, just coming home from the breeder or from the pound or from the farm in this case, things like that. So really good episode, really super useful. Gang, this episode is made possible by my friends at Hills Pet Nutrition. Make sure you check out Hills Veterinary Academy. If you haven't taken a look at it, it's a fantastic resource. I'll put a link to it in the show notes. It is great for learning around nutrition and communication. Guys, without further ado, let's get into this episode.
This is your show. We're glad you're here. We want to help you in your veterinary career. Welcome to the Cone of Shame with Dr. Andy Roark.
Welcome to the podcast, Dr. Camille Torres. How are you?
I'm doing well. How are you? It's so good to be here.
I'm great. Thank you so much for being here. For those who do not know you, you're such a fun unicorn. I love general practitioners that then go back and then get boarded, and they have that wisdom and experience of being in general practice, and then they have the specialty knowledge on top. You are a general practitioner. You're actually double boarded. You're an ABVP, so American Board of Veterinary Practitioners, and then you went on and got boarded in nutrition. You are now an associate professor in clinical nutrition at Colorado State University. And I am thrilled to have you on today because I have a question I want to walk through with you, if that's okay.
Yeah, that sounds great. Thank you for having me. And I am excited to talk about your case.
I want to talk to you about a kitten case, but I also want to talk about puppies. I think we can probably do both at the same time, but let me frame this up in sort of a kitten context, and then we can talk about differences with puppies and maybe try to touch both of those today. So it's ambitious to try to do both, but let's try. Camille, I have this kitten who is about 9 weeks old, and the owners have brought this kitten home. Now, they got this kitten at a farm. That's what I'm basically, I'm saying, this is not a joke. They got this kitten at a farm, and they do not know what kind of food the cat was on before they got it. They were given a Ziploc bag with some kitten food. And so they brought the cat home, and they fed that, and then they sort of picked up a grocery store brand kitten food. They're coming to me and they're kind of panicked because they felt like as soon as they got the cat, the wheels fell off. Meaning, very quickly, the cat started having soft stools, and now it's just having pitiful, sad kitten diarrhea. Oh. And so they're bringing it in. I want to ask you about this case. So there's a couple of things here. Number one, obviously the immediate question is, what do we do about this diarrhea? And I want you to run through for me early kitten, management of diarrhea, but then also getting this cat sort of on track nutritionally, just the best practices there. So let's start at the beginning. When you see this, 8 to 12 week old kitten, they're having diarrhea. What are your initial thoughts on sort of dietary management or intervention in this case?
That's a great question and a great case to talk about, because I think it is something that we do see very often in practice. I think we all have our flow of how we approach a case. And I like to start with kind of where am I at before I jump to what do I think is going on? And so, gathering that history. Now, in this case, it's hard because this kitten just came into the home and we don't know what they've been fed. I'm certainly going to be worried about infectious disease, though, parasites. Those are things that are kind of top of my list. I also worry about kittens and puppies, both, that they can become dehydrated so quickly. So making sure that we're acting quickly rather than saying, let's give it a day or so and see if this gets better, And so I think it's great that, that we're in this place now, that they're in here and they're seeing us.
I'm glad you sort of call out dehydration. That's always one of the things that makes me sweat, right? Because I'm talking about, a 2-pound kitten. And, my thought is diarrhea can pretty quickly make this cat dehydrated and we've got a real problem. I don't want to be too lackadaisical about the case, but I also don't want to go just completely hog wild. And also, in both puppies and kittens and into young pets, I don't want to load them up with 9 different things. And we're past the days of reaching for, metronidazole. Like that we don't do that anymore. Talk to me about this. So it's just the truth of the matter is very limited history coming in. I don't really know kind of what's going on. I like your call out of parasites and infectious diseases. I mean, anything else, any other boxes that I should check in that regard? And then talk to me a little bit more about what you're really trying to get in a history.
Yeah, so now I'm going to dive a little deeper into what they are feeding. So perhaps we didn't know what they were feeding before, but now what have they decided to feed? Are they feeding the bag of food that was given to them, or have they made a fast transition to perhaps a new food? Probably our simplest first step would be perhaps the transition was too quick, and now that's, this kitten has diarrhea because of that. So going back a little and finding out, are there other concerns with appetite, energy level? That's going to help me kind of gauge that. How concerned do I need to be? The more lethargic they are, the more inappetent they are, I'm going to be, shifting my plan from maybe trying some treatments versus having them stay with me and get supportive care.
So working through a combination of our history and our physical exam, let's say that we're at a place where, let's say that we're not seeing acute signs of dehydration. Let's just say that the cat's gums are moist and sort of seems to be okay. Not a rowdy kitten, but also not comatose, anything where I think, oh my gosh, I have to intervene. I think where I am with the case, honestly, is I don't want it to get away from me. I don't want to not do enough for it, and I don't want to over intervene. And so, the owners are kind of looking at me. Let's start with sort of the immediate sort of presenting complaint. What are your initial thoughts in these young kittens when we have sort of acute onset diarrhea?
My initial thoughts, when I think about infectious disease, I'm definitely going to be worried about things like panleukopenia if it's a puppy, parvo, distemper, parasites, roundworms are going to be something that are top of my list. And so some of these things we can test for in the clinic, and then other things we may need to treat for and see how they respond. At the same time, collecting a fecal sample to evaluate that. So I'm looking for any of those medical reasons, because as a nutritionist, ultimately, I'm going to be getting to a point where I'm going to feed them. But what I want to do before I say, let's make sure that before we start feeding them, I know that we have checked a lot of things off our list as far as concerns. And so, I want to make sure that I'm covering the things that are common. I'm supporting them from a nutrition standpoint too. And so when I start to think of, okay, I've ruled out infectious disease, I have a fecal pending, maybe I'm waiting, I'm giving a broad spectrum dewormer. And so I'm covering a lot of the things that I think are common. But now we're at that, let's say, this kitten is okay to go home. So then it's going to be what am I going to feed this kitty when I get home? And so then my mind is going to shift to nutrients. The body can adjust to not having every nutrient every time. After as an adult dog or cat, they have more in reserves. But when we're looking at kittens or puppies, they don't have a lot of reserves to build from. So we really need those complete and balanced diets that are formulated for growth, because this is a time in their life where they need those nutrients the most. Okay. So while we can do some things like we'll sometimes feed a chicken and rice diet to, a puppy just to get them back on their feet. I always cringe a little because I feel like, but they need those nutrients that while chicken and rice will provide some protein and calories, it's not going to be all the nutrients that they need. And they're in a place in their life where they really need those the most. Okay. And so when we break down, what does chicken and rice do? And not that's as common with this kitten, but, just kind of thinking about when we recommend a diet that isn't complete and balanced to help them get through, a gastrointestinal upset, what is that providing? Why does it work? Well, one of the main reasons it helps is because it's very digestible. It's highly digestible. So if that puppy or kitten is having a hard time absorbing nutrients, by feeding them a highly digestible diet, we are making it easier for their body to get those nutrients that they need. But if we look at, okay, that's what I want, a highly digestible diet, the good news is we have a lot of complete and balanced, highly digestible diets to lean on. So we don't necessarily have to go with an unbalanced diet. We can feed something that's going to be, Hill's ID, for example, is formulated for growth, for puppies and for kittens. So we can use it for our adult dogs, but we can also use it for puppies and kittens.
Tell me about a highly digestible diet.
Yeah, so highly digestible diets are going to be diets that are easy for our puppies and kittens to absorb the nutrients. Some of the examples, we do have prescription products, and Hills has an ID puppy and Hills ID kitten specific diet. So now we're meeting their nutrient requirements for growth while at the same time providing that highly digestible diet.
When the owners come in, it's always been my perception that the big selling point for chicken and rice is people want to feel like they're doing something.
Yeah.
I think the fact that they make it with their own hands, I think that makes them feel really special. It makes them feel loving. I do, and so, yeah, I think it's that impression of we're doing something that matters or is different. Do you find that it's challenging to talk pet owners in when they come in with their puppy or their kitten and they're like, we're bringing them home and we changed the food and now we're having this problem, and you say, well, let's consider yet another kind of food.
Yeah.
Do you find that to be a hard conversation?
I think it can be. I feel like it's so important to kind of elicit that client's perspective on nutrition. Just having met with the first year veterinary students yesterday, we kicked off our healthy dog, healthy cat lectures. And one of the things I start with is just how passionate families can be about what they feed their pets. And so I think it's really important to understand before I just start saying, this is what we're going to do today. I do like to take some time to understand where they're coming from and what's important to them. Because if there is obstacle with the diet that I'm wanting to recommend, the more I can kind of hear from them what's important to them, the more I can start building a plan in my mind that may align with it. Or if I feel like we really need to discuss, your concerns with feeding this, you want to feed chicken and rice, and I want you to feed a complete and balanced diet. Let's have a conversation around why I feel like this is so important to feed this diet. But I'm using my time when I'm interviewing kind of that family, finding out what's important to them with nutrition, to basically kind of think about where am I going to prioritize this conversation? Because especially in general practice, you may not have that much time. So if you hear right from the beginning that participating in that pet's care is going to be really important, and we need to think about, finding a way to incorporate that. If I just say, don't worry about it, it's not a big deal, then I've potentially damaged that that relationship a little, and I'd rather build it up.
What does that inclusion look like? So say that this client they're like, oh, Dr. Roark, what can I do? This is my baby and I want to be a part of this. Yeah. What are the types of things that you would sort of empower them to do that you feel like I would love for it to be genuinely beneficial, but at least not sort of derail or make other things I'm doing hard. The worst is when you say, well, we're gonna use this sort of prescription diet, or we're gonna use this highly digestible diet, and they go, okay, and they go home and they cover it in ground beef.
Yeah.
Like, 75% lean ground beef, and nuke the whole process.
I know. Yeah. No, you're right. I mean, I think that's just it, is that if we give that space to let them feel like they're taking an active role in participating of creating the plan, because it is that fine line. We are there to give recommendations. We have the training to make those recommendations. But when there's 3 or 4 ways we could get there, then that's when I like to include the clients. We have 3 options here. Which one might align with what is really going to be important for you? And then together we can say, okay, well then, now it's a win-win. We're both able to achieve what we want. So if there is concerns about feeding this highly digestible diet, and I'm saying, this is what I'm recommending that we send this home. If I've spent some time investing in understanding where they're coming from, as well as giving them, my perspective on how I think we can help, usually I feel like together then it's not as difficult to say, and this is the diet I recommend. And I've already built the case for why it's important. So now we're looking at the problem together, as opposed to one on one side, one on the other.
I like it. I think that building the case up before you make the presentation I think that's super smart. Let's say that we've got our puppy or kitten. We've done sort of our infectious disease rule outs. We've done the fecal examination, we know if it's parasites, things like that. We don't have any obvious, causes of GI upset, irritation. How do you start to approach the presenting problem, which is, help my kittens having these liquidy stools in the, in the litter box or outside the litter box, even worse?
Yeah, for that case, I'm going to be kind of going through my list. I think so often with nutrition, we feel this pressure to make the decision the right decision right now today. And we have a little time to see how they're going to respond.
Okay.
So my general approach is going to be, let's start with highly digestible, something that their body is going to be really easy for them to absorb and use these nutrients. At the same time, I want that highly digestible diet to still provide them with all their essential nutrients that they need. So they're going to continue to, get what they need during a time when they're recovering. For the kittens and the puppies that works for, that their stool may resolve, they go back to normal. And then I want to plant the seed for, do we need to stay on this long term? Are we going to transition to another diet? If they have another diet at home already, I think it's reasonable to get the diarrhea to calm down and then start a slow transition over to the diet that they already have at home. If the diarrhea returns, then we're either getting into perhaps this diet isn't going to agree with them, or do we need to maintain on a highly digestible diet? And we can, because those diets are formulated for growth, you can continue them throughout their kitten puppyhood. They may just not necessarily need that diet. I like to just kind of plant I always try to plant a seed for this is what we're going to do if this happens, and this is what we're going to do if this happens. So if I have a kitten or a puppy, I've tried my highly digestible diet, doesn't seem to be working, then I'm going to be looking at, okay, what else? I'm really going to be trying to understand, could it be related to the amount or lack of fiber that's in the diet? And while we usually think of fiber more for our older dogs and cats, I still think fiber can play a role in some of these puppies and kittens. And we want to be careful that we're thinking about, what type and how much, because it's not, when we say the word fiber, it kind of feels like it's one thing, but it's actually so many different types. So then I look at my current diet and I look at the diet they were on, and I try to make some comparisons of how much fiber are they getting in this diet? Is it low in fiber? And perhaps that's the next place I need to look. If that doesn't work, I'm looking at the type of protein. Now I'm getting into a very uncommon, but is it possible that we have some adverse reaction to food? And again, that just doesn't seem to be as common in puppies and kittens. They typically have onset later in life. I think it's also reasonable to be prepared for, what do I do if they don't get better?
Yeah. What kind of monitoring do you set pet owners up to do at home? So they've come in, we looked at the problem, we've done the history, we've talked through them, we said, hey, look, we're gonna change your diet up here, and I think that we can resolve this way. And we send them out. Again, we started and said this is sort of a 9-week-old kitten, we're about 2 pounds. Obviously, we sort of want to keep an eye on it. Camille, what kind of guidance do you give to pet owners? What should they be looking for? When do they call me? When do they start to worry that this isn't working? If it is working, what kind of follow-up schedule do you set? Talk to me about, once they go back out into the world, I'm going to have a little bit of anxiety just because this is such an itty bitty that I just, as I said, I don't want to get away from me, but I also, I want to be clear with them about what they're looking for, how they're helping and supporting me. And then it's going to let me sleep well at night to know that they've had good guidance on what to do and when.
Yeah, I think that's an important piece of not just nutrition, but also just management of our young patients that are coming in, that we want to have a very clear roadmap of when they need to come back, and, just on a regular schedule for vaccines, but also, what do I expect? What's the course of this disease going to look like? And so I'm going to coach them through some signs that would worry me. If it's lethargy or decreased appetite, that's not something I want to wait on. I want to know about that right away. If the stool is starting to get better, but still soft, I want to give it a little time, but with a little time in a kitten or puppy is probably going to be a few days.
Okay.
I don't want to let this get away from me, because I want an opportunity to modify my feeding plan if I'm not on the right path. And I also want to make sure that we don't have any new signs that have popped up. So these are the patients that, I think everyone has their own system. I used to have my records that I would flag. These are the cases that I want to make sure I'm calling back. We can have our technician team call back some of our cases as well. But on those first couple, when I'm not sure, I want to be the one, because I just hate to miss something that, maybe I didn't describe it in a way they understood. And so I want to know that things are on track.
Okay. Thinking about puppies and kitten and sort of nutritional management and gastrointestinal issues, what do you know now as a boarded nutritionist that you didn't know when you were in general practice?
I think it's just the power of food is so much. I didn't realize what an impact diet could have. And I felt like sometimes, if I had a case with a particular medical condition and I'd reach for that diet that aligned with that. And then if it didn't work, I kind of felt, well, I guess diet won't work. And now I realize, there's so many more options beyond that first choice. And it's okay if we don't get resolution on the very first step. I mean, of course, our goal is to have that resolution, but I think I would definitely tell myself that each success or failure is helping you understand where that may be coming from. So if they're not responding to the diet in the way that I would like them to, that's information in itself. And so with each diet that I select now, I want to kind of justify to myself, why are you reaching for this diet? Like, what do I have in this diet that I didn't have in the other diet? And maybe I'm looking at digestibility. Well, if these are both highly digestible, why would this work over this work? Maybe the fiber content is higher or lower. So now it's more of I'm reaching for this diet because it's different in these ways. And by it being different, it will help me now test, is this patient going to be diet responsive to this particular nutrient profile?
Camille, if someone's got a budding interest in nutrition, maybe they were like you used to be, they're in general practice and they start to say, I think there might be more over here for me to explore. Or if they're just, I don't know, they've got a challenging case. What are your favorite resources out there?
I think the exciting thing is there's so many neat, online resources for nutrition. It's definitely a passionate topic. There's the Hills Academy. That's a great resource. I think that's a great place to not only look at nutrition options, but also communication. How do we have these conversations around diet? So I think realizing that nutrition it's different. It's not like prescribing your ear medications for an ear infection. You don't have a lot of debate. There's a lot more of, we have to include the families in the decision-making. And so being comfortable with communication skills, I think that can be a huge help. But if there's truly that interest, it's looking for those webinars and those opportunities that come up so you can just start learning, because that's ultimately how I started.
Thank you so much for being here and talking through this with me. I really appreciate you. Where can people find you online?
Yeah, so I'm at Colorado State University and we offer remote consults. So we have clients from all over the country. It's really exciting that we can see people all over. We even have some clients from Canada. And so it's great to be able to provide this resource to families all over. We also offer veterinary consults if there's questions. So we can be reached through our website. We have a link there and we're available for families and for veterinary teams.
Thanks so much for being here. Gang, thanks for tuning in and listening, everybody. Take care of yourselves, gang. We'll talk to you later on. And that's what I got. Guys, thanks for being here. I hope you enjoyed it. I hope you learned something. Again, if you into nutrition, Hills Veterinary Academy is an outstanding place to learn, and just it's such good resources there. So anyway, guys, check it out. Take care of yourselves. I'll talk to you later on.